So good morning and welcome everybody. Thanks for coming. We will record the meeting and we'll put a recording on the website shortly. Apologies from Dudley Sawyer, the chair, who can't be with us today. He's at the NEC at an exhibition and he's speaking a couple of times with regard to social care and also with regard to the Black History Month. We're doing a series of 3 meetings. This one on the 27th and another one on the 17th, really around organisational culture in social care. And if you get the organisational culture right, you will make it easier to recruit and retain staff and also to meet the requirements of CQC. There is a lot to cover this morning and in the next couple of meetings. I will put some items on in the chat room chat box for you to download, and I'm sure that Laura from Skills for Care will do the same. We've also got David Vincent with us who will talk to you about accessing Workforce Development Fund, which again comes through Skills for Care and is very, very useful to you. And as a part of that, you do have to sign up for sorry, Laura, it used to be called NMDS, but it's now changed its name. But we are desperate for social care to have better data, and the Department of Health is also desperate for social care providers to sign up, and so that we've got a better data presence as opposed to the NHS, which has got fantastic data. So without further ado, Laura, if I can hand over to you, your co-host, so you can put your slides up and then we'll get them and circulate them later. Thank you.
Can everyone see the screen? Does that work? Great. So just a quick one from me, as we're talking about wellbeing today. I just wanted to flag up a new resource we've recently developed at Skills for Care, and this is our Workforce Wellbeing Resource Finder. But we know that there's a really overwhelming number of resources out there which are related to wellbeing, and that as managers, perhaps to find what you need, you're having to spend time trawling through lots of different websites and lots of different emails. So this resource finder is really aiming to pull together all the resources that are particularly relevant to social care all together in one place. And this includes resources from Skills for Care, but also from a wide range of other organisations as well. So it's not just Skills for Care resources that you can find on this. So if you go to the link on the slide, you're asked a couple of questions. So you're firstly asked what type of resource it is that you need, and you're given 4 options. So firstly, do you want something to support leaders and managers? And secondly, it could be resources around support with loss, bereavement and grief. The third option is mental health. And the final option is kind of general resources to support with wellbeing and resilience. So once you've selected the type of resource you need, you're then asked why you're looking for a resource in this topic area. Is it to support yourself as a manager? Is it to support your colleagues, your staff? Or is it for the people that you support? And once you've answered these 2 questions, you'll be given a list of resources that may be helpful. And this could be a recorded webinar, it could be a helpline, maybe a website with a live chat function, or perhaps some guidance. So you'll have this list of resources you can have a quick look through and see if any of those are going to meet your particular needs. So as I've said, it'll just save you a bit of time having to look through different websites and different emails to find what might be helpful for you. It'll all be in one place. It's kind of a one-stop shop, I suppose. So do have a look. And also we're constantly updating the resource finder. So anything not on there that you've used and found particularly helpful, do let us know and we can make sure it's added so other managers can benefit from it as well. So that was it for me really, but really helpful. So hopefully to save you time, and do have a look if you get the chance. And I'll post a link into the chat as well.
Thanks, Laura. That was short and sweet. And hopefully, I mean, what we have to say about well-being, I mean, clearly from the conversations that we're having, many managers actually don't take the importance of staff well-being and mental health that seriously. And 1 in 4 adults is suffering mental health issues at any one time. It's the biggest cause of absence in the UK economy. And over the past period, 41% of employers have seen an increase in mental health issues. Now, if you've got a lot of staff, fine. If you have a small number of staff, having 1 or 2 off for unplanned absence is actually critical to your business. And that's whether it's a for-profit or a not-for-profit, a charity, whatever. It makes a huge, huge difference. So you need to be aware of it. And also, it's a central part of good organizational culture. And links with recruitment and particularly retention and the ability to meet CQC CLOEs. And when we talk to CQC, we hear the same message about the problems with quality caused by absence, organizations not having proper plans, organizations not having employee benefit schemes. I know these are expensive, but then can anyone tell me if they've got a cheap way to recruit staff? And how much do staff leaving on an unplanned basis cost your organization? They cost a huge amount of money. And we will come back to this later on. I've got 1 or 2 other resources, to add to the chat room that you can access free, not just from Skills for Care. There's NICE out there, and also all the ICSs, the 5 ICSs across London, all have portals that you can access. They may vary, but some of them are fantastically useful, and there's a huge amount of information there that you can usefully use and pass on to your staff. So they're not just for you. Those facilities are for your staff, and they're free, they're confidential. You don't have to be registered with a doctor. Is David Vincent with us at the moment? I can see a couple of Clarendon registrations, but I'm not sure whether Dave Vincent's here.
Can't see him on the list.
I can't. I can see a couple of Clarendons on there, but not.
Yeah, nursing homes rather than home care.
Yeah. Okay. Well, Dave Vincent will join us and talk about how to get Workforce Development Fund from Skills for Care. Can I ask, I mean, if you like a simple show of hands or a comment, are we correct in thinking that many of you are looking for staff at the moment?
Yes.
Yeah. So I think it's pretty common. And how has the the vaccination situation affected you?
That's one thing, by losing good staff, because there's few staff who didn't want to have vaccination, and they obviously have to leave the job because it's now mandatory to have the vaccination.
Yeah.
Yeah, so I lost some staff, and also due to the COVID and the facilities of sickness pay and stuff, staff decided to go to NHS. That's the truth.
Yeah.
Yeah.
Some of the NHS units have been a little naughty, shall we say. They've actually been recruiting social care staff on the basis that join the NHS, you don't have to have a jab. This has been raised with the DH, and there have been representations to some CCGs, etc., have had their wrists slapped for that approach. I will add something to the chat about vaccinations, because there are some queries coming up about when staff actually have to have their vaccine with relation to the second vaccination with regard to November the 11th. And there is some quite clear guidance, but there seems to be some confusion perhaps local authorities are giving slightly different advice. I'm not sure, but I will put something in the chat box later that you can pick up on, and you can query. And if you have any queries, pick it up with your CQC inspector. And we will revisit this on the 27th when we're doing the recruitment and retention. On a more local level, one of the things that Dudley is very keen on and has asked me to mention again is that managers in a local area really ought to be getting together to share resources, to look at their own recruitment, and to have, you know, WhatsApp groups or something local to actually pass on information and work together. It's a useful part of your business continuity process planning, and again, something that CQC will ask you about. So something you actually need to get covered. And I was really hoping that Dave Vincent would have come along, because it would have been useful to have that covered at the same time as Laura was here, so that if there were any queries about what's required, we'd have all the expertise on screen at the same time.
You want me to talk about it, Peter?
Yeah, please.
I can probably bring a slide up, actually. I must have got one somewhere about WDF. Give me a second.
Are there many of you actually claiming Workforce Development Fund support at the moment?
I asked for it and I'm eligible for it. I'm just waiting for Peter to come back.
Good.
Okay, I'll just share my screen again. Managed to find it. So the Workforce Development Fund, and we've had this at Skills for Care for about 20 years now, but the aim is for the money to go to care organisations, all types of service, to develop their staff, including their managers. And what it can fund is accredited qualifications, such as the diplomas in health and social care, which have replaced the MVQs. And it can also fund smaller qualifications, so awards and diplomas in topics like dementia care, stroke care, kind of falls prevention, learning disabilities, mental health. There's a really wide range of topics that you can choose from. We've also got some learning programs. So there's an end-of-life care program you could do. There's some management development programs, including one called Moving Up. There's also apprenticeships that you can claim for, and some digital learning modules as well, which again might be helpful for you as managers or for your deputy managers too. So all this money is here for you to claim, and you want to keep it for South West London employers. You don't want to lose it to other parts of the country. So please do have a look into this. And if you go to the link at the bottom of the slide, you can actually find the full list of the qualifications and the learning programs which are funded. And just to give you an idea of how much money you can claim back, for a level 2 diploma, I think it's up to £600. For the level 3, it's about 800. And for the level 5 diploma, which is the qualification aimed at registered managers, that's 1,500 that you can claim back from Skills for Care. So we pay retrospectively. So once you've completed a qualification, you just need to provide some evidence, which will usually be a certificate. And once we've received that, we can then reimburse you. And the current funding round is running from, it kind of started in January of this year, and it's going through to March 2022. So if you or any of your staff have completed a qualification since January, do get in touch with David Vincent, and he'll be able to let you know how you can potentially claim money back for that. And David Vincent, so we route the money through employer-led partnerships, and there's one for South West London, which is led by David. So David's responsible for kind of administering the claims, reimbursing you. He can talk you through the whole process and just give you the information that you need. And I've put his email address on the slide at the bottom there. So if you do want to find out more, just have a look at the website, but do also email David, and he can let you know a little bit more about how it works locally. It's just a good chance if you are paying out for training, just to get some of that money back. I know how tight budgets are. So rather than kind of not train staff, do have a look into this as a way of getting the money back. And perhaps being able to put your staff in courses that you are able to afford normally. I mean, in many cases, for some of the learning programmes, the funding will cover the full cost of the programme. For qualifications, you may need to contribute a bit as the employer, but it is quite a significant contribution that you can get from Skills for Care. Yeah, I think that's everything on that. So do please talk to David, or do give me a call if you want to have a chat through as well. And I can give you a bit more information about it. But I think it's just a really good resource. We want to make sure there's lots of take up in South West London.
Okay, great. Thanks, Laura. Any questions on that at all? Okay, well, we'll put that information on the website again, and we'll circulate it through WhatsApp, etc. And it's a very useful resource, and many of the training providers, some of you will use people like John Buttle, etc. They will help and support you with that, and enable you to access the funding. They'll provide the evidence, etc. And at the moment, when funding is very tight across the sector, and it doesn't look as if it's going to get any easier, certainly over the next period, it seems likely that that we'll see pressure on local authorities with regard to funding after the budget comes out, which I believe is next week. So I'm sure you'll watch that with attention. So what else can we actually tell you at the moment? We've got a couple of practitioners coming along to talk about keeping well. You will work across various parts of London, and each of those areas may have different ICSs or CCGs covering, and each of those ICSs has a separate portal for keeping well. Probably the two best ones at the moment are South East London, which is led by SLaM, that's the South London and Maudsley, and also North West London. And those portals have a fantastic amount of resource on them. The other three are catching up, but you can actually use any of them and just download the information. And there's also training available in some areas for wellbeing champions for your organization. In some areas that's paid for, but it's a relatively small amount of money. It's virtual training, and that comes up with a certificate, and it's very useful for CPD. And then in other areas that may actually be available free. There are some training schemes on the portals that you can download for yourself, and if you've got a training manager or as a registered manager, you're training your own staff, you can run that yourself. And again, that's very useful from the point of view of CQC. It ticks a couple of boxes for the Chloes. How many, just briefly, do any of you have a paid for employee benefit scheme or employee assistance scheme? Maybe you use one through Citation or Krona or something like that. Okay. Many of you are smaller organizations, and they can be a little expensive, but they are very beneficial. And you find one of the reasons that we've picked up that staff are going from smaller to larger organizations is that benefit is available as a part of the remuneration package for larger organisations, and it does tick a box for staff. Many of them are able to access information that they wouldn't otherwise be able to get to, and get support. And much of what's available on an employee assistance scheme is actually available to you free through the portals. But it is important that you actually share it with your staff. And again, what we're finding is that staff working in DCAs are feeling very lonely, very isolated, and not getting the support that they had pre-COVID. So you need to make the effort with virtual meetings, virtual social meetings, and just make sure that you phone the staff on a regular basis. Just have a chat to them, find out if anything's wrong, anything concerning them, anything you can do to actually give them a bit more support, give them a bit of help. And particularly as winter is coming on, we're moving into autumn, darker mornings, darker evenings for people moving around. And again, it's a concern. What can you do to help people feel safer, particularly women traveling around on their own? Something that you need to actually look at. With regard to CQC, have many people had any PIRs through, people doing their PIRs? Good. How have you found that?
Lengthy exercise.
Sorry, didn't catch that.
It's a lengthy exercise.
Yeah. Yes. But did you find it useful for your organization to do a bit of an audit? Definitely.
Yeah, it's kind of giving you time to reflect back on how things were, and
yeah,
also to gather information. Sometimes you're working every day, you actually forget to gather information.
Yeah, yeah. And I'm sure you all answered absolutely honestly.
Terribly.
And you all put in what went wrong as what went right.
Transparent, very transparent. Yeah.
Yeah. I mean, I think what people need to do is, with all these exercises, is use them as an audit. And the way that the inspections are going to go is that if you do a PIR, you're not necessarily going to get a physical inspection. They may call you up and ask you various points to clarify things. And if they're happy with the answers that they get, then they won't come in and do an actual inspection. I think at the moment, if they are looking to change a registration grading, say from RI to good or vice versa, then that has to be done physically. But they are looking to move away from that, because they want to actually spend perhaps more time talking to your staff, which they can do, of course, remotely. So you need to try and make sure that your staff answer correctly, and not say no to everything. We have had occasions where staff have said, no, we haven't had this training, and no, we didn't know about that, we weren't told, when in fact they'd signed and clearly had that participation. So again, you need to make people aware of their role in the organization. I see that Dave Vincent has now joined us, so I'll pass over to Dave.
Hello, Peter.
Hello, good morning.
Morning. Sorry, I thought I was at 10:30, so apologies if I'm late.
No problem. Laura has done a bit of information already. Would you like me to pull your slide up and we'll go from there?
Okay.
Fine.
Sorry, Peter, are you getting the slides up?
Yeah, I'll pull the slide up. I should have it here somewhere.
Okay. Well, while we're waiting for that, good morning, everybody. As I say, sorry I'm a bit late to the party this morning, but I'm here to talk about the Workforce Development Fund. My name is David Vincent. I'm the General Manager of Clarendon Home Care, so I'm a I'm a home care manager myself, but I also act as the lead partner for the South West London WDF partnership. So just going to have a brief few minutes today just to talk about the Workforce Development Fund and what it is. If you could click on slides, please, Peter. So hopefully some of you would have know what the Workforce Development Fund is. It's a fund of money that's administered by Skills for Care, which is to help adult social care employers to reclaim some of the cost of training for your staff. So what can we claim for? Well, it's anything that is on the list of eligible training, which is on the RQF, the Regulated Qualification Framework. Now, typically, most people will know this as the diplomas in health and social care. Used to be QCF, they're now called an RQF. So you get a health and social care level 2, level 3, or level 4, or level 5 for the managers. But there are lots of other shorter courses, like for understanding dementia or medication administration. There's a whole list of all the courses on the Skills for Care website. And the way the Workforce Development Fund works is that you'll get the training arranged for your staff, and once it's completed, you can come to me and reclaim the cost. So, for instance, on a level 2 diploma, you can reclaim £600. On a level 3 diploma, £800, and so on. If you could click through a few slides, Peter. There we go. So for this year, the priorities for the Workforce Development Fund is very much to try and support the new managers or existing managers. So the diplomas I was just talking about, you've got the level 4 and level 5, which hopefully some of you have done or interested in doing. Like the level 5 diploma in leadership and management is what you need as a registered manager, which is quite an expensive course. It might cost £1,500 or more, but you can claim £1,500 back. If you're not looking to do the diploma at the moment, there are some other really good learning programs that have been running for the last few years. Lead to Succeed and Well Led, which will help you with focusing on your CQC objectives. And the courses that are running, and they cost £500 per learner, and you can claim all of that back. There's also some smaller modules, understanding the workplace culture, understanding performance management and self-management skills, and those are smaller ones that you can get £125 for. There are also some online digital learning modules, which are on the Skills for Care website. And you can sign up for those and do those, and then you claim back, I think, is it 50 quid for each? Is for your time, basically, for that one. So that's really worth doing. Okay, Peter, if you can click on. So if you want to understand any more about this, there's lots of information on the Skills for Care website, or you can contact me and have a chat through with me about things. That's no problem at all. The only hurdle to accessing the funding is that you need to be able to complete your adult social care workforce data set. Used to be called the NMDS. I'm sure many of you have struggled with over the last few years. It's now called the ASC WDS, Adult Social Care WDS. It's actually much easier to complete than it has been in previous years. But the idea is you have to complete all your workforce data, including their training data, and that gives Skills for Care a lot of important information about the state of training in the sector. So you have to complete all that data for your staff. Depending on how many staff you've got, it will take a short or a longer period of time. But once it's done, and then you're able to access the funding. So that's it really. Bit of a brief overview of it, but if anyone's got any questions for me, I can answer now, or my details are up on the slides. You can contact me.
Any questions for Dave? I'm surprised if there aren't any questions when a man's offering free money.
Oh, and by the way, there is quite a considerable amount of money as well. I've got thousands and thousands of pounds in the pot to give away. I have existing partners in the partnership, some of which are actually on this call. I can see the names, who have claimed thousands of pounds over the years to help with their training. But there's plenty more money available. So new members are welcome. Part of my remit is to come to forums like this and speak to new people who may not have accessed the funding before, and try and get you to do it, because like Peter says, free money, you don't often get that.
Right. I see there's a question in the chat from Sarah. Is there any funding for level 7 diplomas?
Level 7, no, not that I'm aware. Is that, what's a level 7 diploma?
Level 7, my understanding from when we used to be involved with it, was it's university level.
Okay.
And I think I'm correct in saying, I'm not sure if Laura's still here. I think Laura's gone. I think WDF only goes up to level 5.
That's right, yeah.
Over that is university funding. You may find that some colleges have funding, and there are some separate funding streams that cover level 7. And I'm not aware, I don't have the expertise at the moment, but depending on whereabouts you're physically based, you may find that you can access local funding. But drop me an email and I'll see what I can find out, Sarah, because we have been asked that question before, and we actually, at one point, there was a couple of training, or there were rather a couple of training providers who were doing some level 7 units, which they got. They're actually management and leadership units. They were very good, but they did come with funding. So just bob me an email if anyone's got any queries. Bob me an email with the geographic location of either the candidates or the place of work, and I'll see what we can find out for you. Okay. Anything else for Dave at the moment? Okay, but I would appeal to you yet again to complete the good old NMDS, because as a sector, social care is desperate for better data. And if we're going to ask, as we frequently do, the DH and the DWP and the rest of government, or basically the Treasury, for more money, they keep saying we don't have the data to support. And if you look at the NHS, they have so much data. They can tell you how many of their staff keep budgies, how many of those budgies have got green cages. They'll tell you everything. And the DH love that and give them lots of money against it. So, and frankly, I think that data provision is going to become a requirement. So you might as well, frankly, just bite the bullet and get on with it. And I would guess that you're all doing the tracker. And if you're not doing the tracker, then someone will be chasing you. And there is a point coming up when the tracker may not be obligatory shortly. But I would suggest that if you don't do it, your local authority are not going to be very happy with you. Mm-hmm. So you might as well accept that it's as good as obligatory and simply get on with it. And frankly, the sort of information that is needed for for the NMDS successor is actually the sort of information you should have to hand as an organization anyway, basically. But I'll stop moaning on about that. I see that Hannah Wilson from SLaM has joined us. Hannah, hello. Good morning.
Hello, good morning. I think also my colleague Nadia says she's just waiting to be let in as well.
Right, okay. I can't see anybody actually waiting to be let in.
Oh, interesting.
So
I'll tell her to close it and start again.
Yeah, I can't see that. Hang on. Yep, it's just popped up.
Popped up, fabulous.
So Nadia
Let
will
Nadia in.
shortly. Nadia's
There she
appeared
is.
on screen. Hello, Nadia. Right, good. Without further ado, these two colleagues are from SLaM, which is the South London and Maudsley. They have been heavily involved in putting together the brilliant portal that SEL has around staff health and wellbeing. And they'd like to show you a set of slides. Now, some of you might not be in the SEL area. That doesn't matter. You can still look at this lot. And I will also put up the details of the portals for the rest of the London ICSs as well. So I will pull up who's going to operate the slides? I'll just make you co-hosts.
That's me.
That's Hannah.
That's me. Thank you.
Hannah. Okay, I'll make you a co-host.
Thank you very much.
And I'll pull the slides up for you and then you're off.
Lovely. So first of all, we'll just kind of introduce ourselves. So my name's Hannah Wilson. I'm the clinical lead for Keeping Well in South East London. I've got with me today my colleague Nadia. Nadia, do you want to introduce yourself?
Hi, I'm Nadia. I'm a Keeping Well practitioner. Yeah.
Lovely. Thank you. So as Peter said, we're going to be talking mainly around kind of some of the offers that are available in South East London. But these kind of wellbeing hubs, they are kind of national. So there's lots kind of nationally, I think we've got about 42 hubs, but also there are ones in each specific kind of ICS area in London. Okay.
Have you got the slides up?
Oh, yeah, it's showing them. I don't know if I have control.
Okay.
Request. I think I can request it.
Yeah.
If not, I can always.
You've got it. You've got it. It should work for you.
It should. Oh. No, doesn't seem to be. Oh.
It is.
I'm just being impatient. That's all that happened. That's fine.
Okay.
Okie dokie. So what I'm going to kind of briefly whiz through then is kind of what Keeping Well is and kind of how it started and some of the offers that we have available. And then I'm going to hand over to Nadia, and she's going to talk in particular about one of the things that has come up quite a lot when we've been doing some of these kind of conversations about kind of the hubs and what we can offer on kind of reducing absence, and how actually some of the things that we have on offer can help to reduce absence within teams, and knowing that has been kind of quite a big problem, I think, across both health and social care. But I guess kind of the leeway and the flexibility with some of that being slightly easier in the NHS. So we wanted to think a little bit about how the portal can help with reducing absence among teams. So I'll hand over to Nadia in a little bit, but I'll start off with kind of talking about Keeping Well. So Keeping Well was set up, I guess, really in response to the widespread recognition of the impact of the pandemic on health and social care staff. NHS England funded a number of hubs, and South London and Maudsley were tasked with setting up the portal that runs in South East London. So during, so hopefully that'll flip. Oh, no. Oh, there we go. Sorry, again, I'm just being really impatient. I'll try and slow myself down. So the first kind of phase of this whole project, which started in January and led us until about May time, was to set up this portal. And we did a lot of kind of reaching out. We did a lot of I guess kind of connecting in with lots of people in lots of different sectors to think about what would this need to look like, what would this portal need to include, what would be the things that we'd need to kind of have available for health and social care staff. We did a lot of work with LCaS to kind of think a little bit about kind of the social care sector and what we'd need to kind of see on this portal. So this is the landing page, this is the home page, and we've got some beautiful artwork, which Nadia actually does a lot of our artwork for us, so she's very talented. So she's done some lovely images for us. And so this is our kind of landing page. And what you can get to from the landing page, from the home page, is access to kind of everything. So the key thing is that we provide free, fast and confidential wellbeing and psychological support. And I think often when we mention that, automatically the mind goes to kind of, formal kind of therapy and, psychological kind of therapies. That's not the case. That might be one of the routes that we offer, but it's not the whole story. So if that is the area that you're interested in, if you are interested in receiving more formal psychological therapies, you can access that through our website, and health and social care staff are being prioritised. So that means that they'll be given the first appointment available for both assessment, initial assessment, and then kind of treatment if that is kind of the plan moving forward. So that is available. But like I said, it's not the full story. There are lots of other things kind of available on the site. So that might be things like accessing, oh, again, not working. Is it working? Oh, I think so. There we go, lovely. That might be things accessing self-help materials and information and resources on different things like sleep, stress, anxiety, maybe more specific things you're looking for. So, you're concerned about the changes to restrictions, or suffering from kind of symptoms of long COVID. There's lots of different things that you can kind of access. And one of the really good things about the Keeping Well portal is that we've been able to work alongside specialists in each of the areas to make sure that the information is relevant, it's up to date, it's useful, it's kind of, hitting all the right marks. So in particular, when we've been looking at low mood, we were very lucky to work alongside Dr. Sterling Morey, who is kind of a leading kind of specialist in low mood. He created a video for us. He's got a lovely kind of welcome video to kind of help kind of talk things through. We've also kind of worked alongside the long COVID clinic as part of Guy's and St Thomas's Hospital to make sure that the information we've got on long COVID is up to date, it's relevant, it's hitting all the right notes. I guess the big thing about this is that we also are very responsive to feedback. So we did have some feedback that it would be really, really nice to have a space for menopause and what to do about kind of, menopause in the workplace. So we worked really hard and really quickly to kind of set that page up. We worked alongside people who are at the moment working on the legislation for menopause in the workplace. Got information from them. We've joined kind of task and finish groups to be part of those conversations. So every time we're kind of receiving feedback, we're trying to be responsive to that, and we're trying to make sure that we're kind of responding to the needs of the people that we're serving in kind of South East London. So again, like I said, self-help support, lots of information, but also clicking on the wrong buttons now. There's also kind of other information and resources that might link slightly less to, mental health problems or kind of more kind of formal kind of problems. It may be just generally you want a bit more information on keeping well. How do I keep myself well, particularly during this period, particularly during the pandemic? How do I keep myself well? What are the sorts of things I can be doing? So on there, we've got things like eating well. So we worked with a nutritionist to think about what's the advice that we can give around kind of eating well. We've got information on kind of, how to get into exercise, particularly if kind of exercise is not your thing. How do we kind of, build up to that? We've got information for children and families. We know that actually, we're all kind of doing our roles as best we can, but it doesn't stop things going on outside of kind of our roles in the workplace. We still have roles as kind of family members, maybe as parents, as partners. So kind of thinking about how we can make sure that all of those things are being kind of supported as well. There may be kind of financial concerns or, things around kind of working shifts and night shifts. We know that night shift workers have been kind of really impacted. So again, lots of resources in lots of different areas that we've been working with around providing the right support and working with kind of specialists in those areas. So aware of the time, and I want to make sure Nadia's definitely got enough time to kind of do her stuff. So I'll move on. We know that actually sometimes reading a lot of information on a page just isn't going to sink in. And sometimes when we're faced with a lot of information on a page, we can switch off. I know I do this sometimes myself. You get those big long emails in your inbox and I'm like, I just don't even know where to start. So actually kind of thinking about how we get that information across and how we can kind of do it in a way that feels more accessible and more kind of usable. So we've got a really great kind of video series This is a combination of testimonial videos from people who have used some of our resources, who've actually been involved with providing information for us for the portal, but also some kind of videos from YouTube that we've had kind of provided for us. So kind of other people have their own YouTube channels, but very kindly kind of offered to kind of have them accessible on the Keeping Well site. It's not a great screenshot because you can't actually see the kind of the number of different kind of series that we've got there, but we've got information on kind of keeping well, those kind of mental health boosters. We've got a range of videos on kind of mindfulness. We've got other things around kind of how to what am I thinking of? What's the word? It's gone out of my head. Sorry, no, thinking about kind of the social care sector, and also thinking about kind of racism and kind of bullying in the workplace, how to be kind of an ally. So it's very wide ranging, and we're building on that as we go. So we're always asking people to be involved if there's particular areas that they're interested in. Can they kind of help add to that kind of video series? So we do have that kind of information available as well. And I guess the final thing being kind of the work-related support. So we have resources for kind of teams, we have resources for leaders that go beyond the scope of kind of that self-help information, particularly thinking about how to have kind of well-being conversations, whether that be a well-being conversation if you're kind of a team member, how do you have that well-being conversation with your manager if you're struggling, but also as a manager, how do you kind of bring those conversations into kind of, you know, supervision or kind of, you know, ad hoc meetings? How do you have those kind of well-being conversations to check in on kind of your team and how they're getting on? So there's lots of kind of different resources, lots of different things that are available, whether it be self-help, whether it be kind of, you know, more these practical bits of training. So we've got kind of leadership training and things like that on there as well. So it's very, very wide reaching, very wide ranging, and hopefully kind of useful for everybody. A good thing also is that we have a chat function. So if you kind of land on the page and you just don't even know where to begin, not even sure kind of what to look at, we have our chat function, which is covered by our Keeping Well practitioners. So Nadia and the rest of the team cover this Monday to Friday, 9 till 5. So it's a real life person. I think sometimes when a chat box comes up, it can kind of be that concern that there's it's a chat bot behind there. It isn't. There's real life people behind there who are waiting and willing to talk to you and give you kind of advice and kind of guidance on where you might want to go for some support. So if you got no idea kind of what you're looking for or kind of where to start, that can be a really nice kind of useful tool. But also if you've had a look at some of the resources and still feel like I need a little bit more, having a chat with our Keeping Well practitioners on the chat function can be a really nice kind of space. We also have a phone line. So again, that phone line is covered Monday to Friday, 9 till 5. So if you'd prefer to speak to somebody over the phone, that's also fine. And if kind of you're looking at the website and you think it would be great to speak to somebody, but I'm just not ready kind of right now, and you know, things are really kind of hectic and busy, we've got a request a callback form on the main kind of website. So you can kind of put in your details and request a more suitable time for somebody to call you back. So we do want to speak to you. If you want to speak to us, we're always there. And with this, with the website, it is kind of usable on lots of different devices. So we know that not everyone is sat in front of a kind of a desktop computer or a laptop every day. Some people are on the move, so they may only have kind of access to things on their phone. So it is kind of user-friendly on all devices. So this is what it looks like on a mobile phone. The chat function appears in the same way on a mobile phone as well. So it pops up and kind of covers the screen. So it is available, it is there, and this is kind of the URL. If you'd like to have a look at the website, please do. And you can kind of give us any feedback. We do have a feedback form on the site, so you can kind of formally give us some feedback. Or if you want to kind of get into contact with me and kind of give us some feedback, that's also fine. But we're really responsive to things. So if there is stuff that might be missing, stuff that you think might be kind of helpful to kind of add in, do let us know. A change that has kind of come, or kind of the next, as we move into kind of next phase, it's really exciting kind of next phase that we're moving into. And as part of that, we're going to have a community forum. So we've been working alongside a company called Island 23, who are responsible for the money saving expert forum. And it's basically an easy and safe space to use in which you can kind of share ideas, share concerns, It's a space that's designed for kind of privacy. So using a username, not using your kind of real name, using kind of an avatar or kind of a picture of something that you like rather than a picture of yourself. So it keeps it all kind of anonymous, but it's an easy space for kind of sharing. And it's an easy space for kind of, you know, feeling as though you're kind of part of a community. We really want this to kind of be a really nice kind of supportive and kind of safe to use space for everybody. There's public discussions that you can be involved in, but also those public discussions can also kind of be continued as private messages. So if there's somebody in particular that you want to message in private about something, that's also okay. It is moderated, so we have kind of a community kind of forum leader who is able to kind of monitor things. So nothing kind of untoward kind of happening. It is kind of monitored, but it's kind of encouraging that discussion and encouraging that kind of sharing of ideas. And at the moment, this is updated a little bit, so this snapshot is kind of slightly outdated. But we're hoping that there's going to be some lovely different kind of areas for you to join in kind of conversations. So there's one in particular for kind of the care sector. That's probably going to expand and develop the more that people join, the more that kind of people are becoming part of the community. But it's a space for kind of discussion of topics that are on your mind, things that you kind of might want to get a bit of support around. There might be things happening in your kind of local area that you think actually this would be really great to kind of get a bit more information from people about what they're doing in their spaces. So you can kind of look at categories and kind of topics that kind of are of interest to you. And I'll just skip that one because it's just what kind of a chat kind of looks like. But I guess kind of we're coming today with a bit of an early ask. So we're doing a bit of a soft launch with the community forum. So if you are in kind of the South East London kind of area, we'd really ask that you do kind of sign up to the community forum, and I'll provide the details of that to Peter, who can hopefully kind of send those out. But to log in, have a look around, start some conversations, generate some kind of topics to kind of talk about. But also kind of give us any feedback. How does it feel? Does it look how you would want this community forum to look? Is there things that we're kind of overseeing? I guess kind of, you know, yes, Island 23 are kind of experts in this area, but they may not be experts in particularly a community forum that is for health and social care staff. So we want that kind of feedback, and we want that kind of, that information. If you feel like the stuff that we're missing, do let us know. So that's kind of where we're at with kind of keeping well as a whole. I wonder if there's any questions just before kind of Nadia moves on to thinking about how it might help with kind of reducing absences among the teams. Is there anything more kind of website specific or portal specific that the people have got questions about?
There's a question on the chat. Can we have the link where we can book for an assessment?
Yes, so the assessments at the moment, that's a good point, and thank you, Esli, for that question, and Nadia for pointing it out. Yes, so the assessments at the moment are carried out, if you're looking for kind of psychological support, are carried out by the IAP services. So those are the Improving Access to Psychological Therapy services, which sit amongst the kind of the 6 boroughs. So if it's a kind of more formal kind of psychological assessment, it would be through that, and we can definitely kind of pop the link in there. If it's just to chat to us, you can do that by coming to the website and having a chat with one of our Keeping Well practitioners. We are going to be moving into a third phase of this kind of project in January, which is where we will be providing the assessments for all health and social care staff to get them into the right care pathways and the right kind of routes that they need to be in. This is not up and running yet. We're still kind of developing our team and building our team, but that will be really easily accessible from kind of the homepage. But for now, yes, we can kind of provide the link into the information about psychological services, but if it is just to kind of chat with us, come to the homepage, and Nadia or one of her colleagues will be kind of ready to kind of chat with you there. I hope that answers the question. Lovely. Okay, in that case, if there's nothing else, I mean, obviously there'll be a chance for questions at the end. What I'll do is I'll hand over to Nadia at this point. Thank you, Nadia.
Thanks, Hannah. So I will be talking about reducing absences. I'll go through some statistics, top reasons for absences, and what we can do to reduce absences. Next slide, please. Okay, so here you can see that health and social care, we have seen the largest sickness absence rate in 2019 and 2020, which is not quite a big surprise, I thought, because we, with the high workload, high working pressures, uncertainties, and dehumanized working conditions, we couldn't see a lot of our clients, our colleagues and families. It's quite normal, I think, for health and social care to be at the largest sickness absence rate. But it's quite interesting that in London, we have the lowest sickness absence rate compared to the rest of the UK. So we might be doing something right. Next slide, please. And the top 5 reasons for sickness absence, if you can see, it's quite small, but it's the first one is minor illnesses, accounts for 26.1% of all sickness absences, and that's including coughs, colds, flu, sickness, nausea, and diarrhea. Just warning, I have been sick with cold, so there's something going around that we might see a rise in sickness absence. Second is others, so it's accidents, skin diseases, infectious diseases that are, and other sickness that are not mentioned there. And then third place, we have musculoskeletal problems. So this includes back pain, neck and upper limb problems, and other musculoskeletal problems. And the fourth, not surprisingly, we have coronavirus, accounts for 14% of the sickness absences. And then we have, on the 5th place, mental health conditions, and this includes stress, depression, anxiety, and serious mental health problems. You can see that there are coronavirus and mental health conditions is highlighted in blue, and that means we have links, we have pages on our Keeping Well site for you to have a look at later after when we send out the presentation, and you can explore the website for yourself. Next slide. And then the top absences that are not related to illnesses, but I think is sort of related, is bullying and harassment, stress and burnout, being a carer, and low morale. We know that bullying and harassment is a really big problem. For example, in our chat, a chat user came up to us and said that they have been off sick work because they have been bullied by their line manager, unfortunately, and they've started to develop some symptoms of depression. So it's really important that we look at workplace bullying, and in response to that, we made a page on workplace bullying. So you can take a look at that. And then we know that our LGBTQ plus colleagues and our global majority colleagues, as well as colleagues with disabilities, they experience a lot of bullying and harassment. And again, results in absences. We can see that a lot of racial discrimination causes racial trauma, which makes them more susceptible to stress, to depression, to a lot of physical illnesses. So it's really important that we find ways to make our workplace very inclusive, and tackle this bullying and harassment problem. And we have tips and resources on how to support your colleagues on our website. And then stress and burnout. Stress is part of mental illnesses before, but it's also here. Stress and burnout is very, very common, especially in the past 2 years. I myself had a burnout the first bit of this year and had to take some leave. And so we created a lot of resources on stress, both in there's a stress section, and also there's a work-related, team resources, all about tackling stress at the workplace. So you can check that out. And then we know that a lot of us are carers, and it's quite a struggle to juggle being a carer and also have to come into work. Sometimes there are unpredictable circumstances, emergencies relating to being a carer. So we have a resource on that too. And lastly, there's low morale. I think with the 19 months that we experience, it's very, very understandable that we have low morale and moral injury. And this again has been raised quite a lot through our chat function. So we made a section on this, on moral injury, on our resources for teams, and you can check that out later as well. Next slide. Sorry, I said I have a cold. What we can do to reduce absences. These 4 things, they are what come up over and over again when I was researching this topic. So management should be approachable. I think on my experience, for example, when I was experiencing burnout, because my manager was so approachable, I could discuss things with her, and we were able to make a plan, reduce my work load to 50%, and then that way I didn't need a month-long or 2-month-long sickness leave, because I was able to approach my manager. And there should be clear and visible absence policy, employer flexibility, and also a lot of wellness programs and events are very good buffers for reducing absences. You can check out a lot of well-being programs and events on our site as well. We work alongside a lot of charities and organizations that provide free events like webinars and workshops. So you can check that out there, but also wellness programs, you can perhaps talk about it in your team. If you would like an away day, for example, or like every Monday have a mindfulness session. Again, that comes back to management being approachable. So that is the first thing that we need to tackle. I was planning to show a bit of the resources that I've put on in here. Is it possible if you click on some of the links, Hannah? For example, if you go to the coronavirus on slide 15. So it makes sense that we talk about coronavirus because it's the 4th top reason for sickness absence. We have resources on vaccinations, we have resources on protection and prevention, and then the page that we will be seeing here should be...
Yeah, I've clicked on it. It doesn't seem to...
I think because it opens on a new window, maybe Peter, you need to go to the other window.
I could see that new window came up when Hannah clicked on it. So I don't know.
Oh, it's not sharing.
Okay. I can just talk about the resources that can be quite helpful on there. So if 14% of us have taken sickness absence because of coronavirus, most of us would have fully recovered within 12 weeks, but for some people, symptoms can last longer, and you can get all this information on our long COVID page. But it's really important that you speak to a health professional, so you speak to your GP, a pharmacist, or call a 111 operator to get advice. But we have really useful information here, like our colleagues from Derby Occupational Therapists, they've developed a bunch of video series. So you can look at managing COVID-19 related symptoms during sickness absence, return to work rehabilitation, and managing ongoing COVID-19 related symptoms in the workplace. And there's also information on recovery. So what you have to do in the first 6 weeks, around rest and recovery. So the focus should be on resting 6 weeks, that nothing you can do about it. But then to prevent future absences, you can really focus on pacing. So again, talking to your manager about taking breaks, reducing work capacity, and pacing. And there's also a lot of information on if you're struggling emotionally with COVID, with long COVID, what you can do. And obviously you can also talk to us on the chat or our phone line. And then the fifth one is mental health conditions. So we have those pages on stress, depression, and anxiety, and they're all very useful. There's a lot of quizzes, really useful apps, and like Hannah mentioned, really useful information videos, and also some self-help. So so when you're trying to manage both work and having a mental health condition, you can perhaps look at the self-help resources, or access the free psychological services that we have. And then we also have a page on lived experience, which is both, so when you're having experiences of mental health conditions, it can be quite hard to continue working, but we have worked with Dr. Rachel Perkins and IPS Girl. They have designed a lot of very useful toolkits to help you survive and thrive at work, even with your lived experiences. So, for example, they have a toolkit on transitioning back into work after you have a big absence period. There's also a surviving and thriving toolkit that you can use every day, or when days are feeling a bit harder, when days are starting to feel, overwhelming. So you can put in place some plans with your manager to think about, okay, what can we do when things are starting to get overwhelming, or when you really feel like you can't get back to work anymore. So there are a lot of very, very helpful resources from all these people that we have been working with. Do check them out.
Oh, lovely.
Okay.
Cool. Well, oh,
Good.
sorry. Thank you, Nadia.
Okay.
I've clicked on. It looked like it was going strange. Anyway, so yes. So thank you for going through those, Nadia. So we are here. We're available. We are ready to respond to any feedback that we might get, but also, if there's anybody that might be interested in doing some joint working with us on anything that we might need to develop a little bit more, there's particular areas of interest for you. If you've got further questions about kind of the stuff that we can do to reduce absence and the things that we can kind of support with, we are here. So there's the website. That's our kind of generic email address. Like I said, there is the phone line available as well, and our chat function. We're ready and waiting to kind of chat with you guys whenever you're ready to kind of come and chat with us. So I think we will end there. Thank you very much, Peter.
Thank you both very much. There's a huge amount of information there. I would hope there are some questions. Anybody got any questions? Anyone points to raise?
So I'm from Equal People Main Cap. Can you hear me?
Yep.
Yes, sorry.
Okay.
I think there's a problem with my volume. Sorry. Yes.
It is a charity in West North London. We this week we have like a lot of sickness, and they our staff are saying that they are overwhelmed with work, and you know, we try to live one day working at home, you know, 2 activities per week. So we, you know, we are not give them a lot of work, you know, that before. But then, you know, I feel that, you know, this is brilliant, but when I ask them, you know, are you okay? You know, what is everything all right at home? They don't want to talk, you know.
Yeah, and I think,
and, you know, I know that you know, that they are having problems at home, but you know, everything, you know, all my stuff at the same time is for me, I feel like, you know, I'm gonna go to crisis.
yeah,
Yeah.
I think one of the big benefits of something like Keeping Well Southeast or Northwest, any of the portals, is that you can pass the information to your staff with the full confidence that they can talk confidentially to people outside of the workplace. Often people are not going to talk to you, Sonia, because it's that workplace link. And this is why it's one of the reasons it's so important to get the information passed down to the staff time and again. And there are so many facets, as you know, Hannah and Nadia have just said, that cause these problems. But there is so much on the portal, so much expertise available free of charge, that can make such a difference to people's lives.
Yeah.
Yeah, and I think this is a problem that we have come across in a number of different areas, is people just aren't necessarily willing to talk about it with kind of managers or kind of whatever. And so I think just having this information readily available, it doesn't even need to be in response to a kind of a conversation. It can just be, here is kind of information that we've been given about keeping well, and get people to kind of check it out for themselves. And I think that's kind of really what's been working for a lot of people, because I think it is hard, isn't it? It is hard to have those conversations.
Yeah, it is. But you know, I think that, you know, I've been talking with other charities, and it's the same, you know, and I will, you know, but I want to help them, but at the same time, you know, the productivity is, you know, sometimes I feel myself doing everything, like, you know, activities, and you know, it's not nobody, you know, doing the operation jobs and dealing with everything because they are not there.
Yeah, and that sounds like a lot on you as well. And it sounds like maybe you know, where's the support for you as well? And that's a really good thing about Keeping Well is that's there for you as well. So this isn't just about, you know, it's great that you can kind of support your team, but it's also having that space for yourself as well. You know, as a manager myself, and you know, making sure that my team's okay, where's the support for me? So I think that's also a really good thing about Keeping Well, is that we want to hit everybody. This isn't just about the workers kind of necessarily who are doing the kind of the day-to-day kind of on the ground work, but also as a kind of a manager for the team, like how can we kind of look after ourselves whilst, you know, supporting everybody else.
Yeah, and I think that Hannah makes a very good point, and certainly one of the people who accessed confidentially the system and then rang us up to tell us what she had done on the system, which is not quite how it's supposed to work, but she didn't actually know what her problem was until she talked to somebody who was able to sort out what the issues were for her in an objective fashion. And in fact, what the issue wasn't what the lady thought it was. But once she talked to somebody like Nadia, who actually knew what was what, she was able to resolve her own issues. She then went back into the workplace and told several other people how successful this had been. And they were able to then phone up and get some of their issues supported as well. And everybody has, doubts and problems and mental health issues at some point. And talking to somebody, confidentially or outside of the issue is very, very useful. And as I say, it's free and it's available.
So it is not just for South East London, it's for everybody.
These portals are all over. It's a national effort. So we have them. All of the different areas in London have them. So there's one in all of the different kind of ICS kind of areas, but they are national as well. So yeah, there's 42, I think was the last count of them. So they're everywhere. And what we're working on our site as well, we haven't got there yet, unfortunately, is to add all the information for all of the other London keeping well hubs. But if you Google it, it will be there. You'll be able to kind of find it.
I've put the 5 in the chat box for the 5 different London ICSs, and I will put I will make up a more clear definition, which I'll put on the website in the next few days. And I'll also circulate that via WhatsApp as well. So
we also have really good connections with the hubs in Sussex and also Kent and Medway. So also if you're kind of in the more slightly surrounding areas, we have really good relationships with them as well. So we can kind of pass on the information for them too.
Yeah, and I think what we can't stress enough is that this information, this service is not just for you as managers or owners. It is for all the staff, for all the people working in your organizations. So in that sense, we are relying upon you, SLaM, etc., are relying upon you to pass that information on, to make it available to your staff. Any other?
Can we have your presentation?
Yeah.
Sonia, I will put them all on the website, and we'll record we'll be recording there as well. And if there's anything else you want particular to an area, if you just email me, I will send that to you without any problem.
Okay.
And the same applies to anybody else in that sense. But don't expect me to remember what has gone on today. Do email me and remind me. Any other points for Nadia and Hannah? Okay, well, thank you very much again. We will be getting you back in future meetings to cover further points and just to keep displaying the availability of the portal.
Yeah, absolutely. And we'll have more updates on kind of the next phase as well, kind of as we move into the assessment phase, kind of coming up as well. But it was lovely to meet everybody. If anyone does have any questions that they didn't want to kind of ask in front of the whole group, which is also fine, just send us an email and we'll respond to you. That's no problem at all.
Okay.
All right. Thanks very much.
Thanks.
Everyone.
Thanks both.
Bye.
Okay. A couple of other things before we close. I'd like to share a couple of things with you. One, firstly, if I can get it up. Okay. Just pop this attention. I'll pop the. I've put the dates of the next 2 events in the chat box with the Zoom links for the one on the 27th, which is about recruitment and retention. We're actually majoring on retention because he says casually, getting staff is not, I mean, I know it's difficult, but the more important thing is once you've got the staff is to actually hang on to them. And something else that might be of interest to you is a sort of freebie. Citation have got some information available. They're actually running a prize draw for a free mock inspection and 1 or 2 other free offers as well. So that's in the chat box, and again that'll be circulated. Can I ask if any of you are having issues where your staff have been, shall we say, poached by the NHS? If that's happened, can you let me know? just email me or send me a text, because the Department of Health has got very cross about it and has wrapped a few CCG knuckles. It's not that we're actually going to name you, it's all anonymous, but we can get that information further up the ladder. And it's likely that there's going to be a change to the requirements, and that compulsory vaccinations will be rolled out across the NHS and also across other parts of social care. So do whatever you can to get your staff vaccinated, and not just with coronavirus vaccines, with the flu vaccine as well. Although I believe that in some areas there are shortages of flu vaccines. So, take what you can. Just returning back to well-being, it's very useful to have a well-being champion in your organization. If you're in the South East London, if you look on their portal, there is some information about that, and we can point you in those directions. Some of the local authorities in South East London and elsewhere have been promoting wellbeing champions. There is some unfunded training. It's not very expensive. The training to be a wellbeing champion takes between 90 minutes and a couple of hours. Virtual meetings, it's very good. Some very good training providers running it. And just something has popped up in the chat box. Yes, interesting, Andrea. Yeah, that's a neat piece of recruitment. When social care staff go to have their COVID jabs, would you like to come and join us with the NHS? Yes, that's very good. And I wonder if any of the NHS staff are getting a bonus for recruiting staff. Who knows? It's a battle to get his staff at the moment. You're not only fighting with the NHS, you're fighting with the likes of Tesco's and hospitality. And it is difficult. I know a number of local authorities are now moving towards compulsory London living wage, which is probably a good thing, but it's only a good thing if you get the funding that enables you to run your organisation properly and fund that. I see that John Buttle has joined us from Social Works. I wonder if John's got any words of wisdom about training that he is able to share with us at the moment.
Hello. I don't know about words of wisdom. I think words of wisdom have gone out the window over the last 2 years. However, we do have a lot of training that is funded by the Workforce Development Fund, the Skills for Care runs. Like I suppose a lot of people, we just turned upside down when the lockdown started. So we used to be classroom only. And then at the beginning of lockdown, we just went, completely hell-bent for leather to kind of see what we could do. So we've come up with a combination of live Zoom tutorials, so a live classroom, but just virtual, with electronic workbooks and tutor support remotely. And that's been working really well. We've put getting on for 700 new care staff through their care certificate, funded on the back of the level 2 medication RQF, which they do as well. And so we run a cohort every Thursday, which runs over 4 days for new workers. And anyone who is linked in with the Workforce Development Fund can access that and get that fully funded. We just charge the same rate as the funding that comes to you from the WDF for that. We do the same principle with a level 2 dementia awareness, which is around about 4 hours of live teaching and then remote support for people to complete a workbook. Same principle with a level 2 autism course, but that one we run over 3 days. We do all of the Skills for Care funded management courses, Lead to Succeed, Well Led, plus a few little one-day modules as well. It's interesting that we've not really had many requests to go back to the classroom, because I think with the way we're doing it means that anyone can join. So if you're a small organization and only employing 1 or 2 staff a month, you can just send them to whichever kind of session that month suits you. Same with the dementia. If you've only got 1 or 2 people, that's fine, because we'll have 1 or 2 from somewhere else and 1 or 2 from somewhere else. So I think the virtual model is here to stay, and it seems to be working both for us and for our customers. But I mean, I would just strongly recommend, if anyone's interested, Peter's got my contact details. David Vincent, who's here as well, runs one of the bigger London partnerships, and we work with him. And I can see a couple of our customers sitting here as well, so I hope they would be prepared to give us a good reference. I think the main problem people are having is just getting people to train. I think that's the really tricky thing at the moment.
I couldn't agree more with what John's saying about getting people to train. What I would say to you, and perhaps this is a hammer to crack a nut, that we are seeing CQC, as they are now coming back to inspections, wanting to see a properly fitted staff training matrix, and they're wanting to know what is happening about CPD and the evidencing. And because they're able to access staff remotely, they are actually finding out a lot more about staff training. And they are exposing some, they're turning over a few rocks and exposing some pretty nasty things underneath. And it's a very easy win for CQC, if you want to look at it like that, for them to cause an issue with your business. And again, when we do exit interviews on staff, one of the reasons that people are leaving and going elsewhere is because they're not happy with the training or the support around developing themselves. And it isn't expensive to do training. It is an investment, and it also keeps your staff on board. And if you think it costs you, a couple of grand to recruit a care assistant, if you save 10 care assistants a year, that's 20 grand. That's a good increase on your bottom line.
Yeah.
And training makes a huge difference to the quality of the care you provide.
Yeah. I mean, I think, it's one of the things there are lots and lots of training providers out there, but I think because we're all specialist in care, I'm a social worker, Jenny, who's the other director, social worker, we've got nurses and care managers all working for us as trainers. I think we do try to make sure that we don't just go through the motions, and that people actually do go away learning something, which shouldn't be an unusual concept, but it does seem to be sometimes.
Perhaps we shouldn't laugh about it, but you're so right.
Well, it's true, unfortunately. Yeah, I mean, that's why we started training, because we'd spent a little while doing consultancy with other companies and thought, oh my God, this is dire. We've got to be able to do it better if we did it ourselves. Quite.
So there you are, folks. You've got a good trainer, and you've got someone who will actually give you free money to do that training.
Yay.
So well done, Dave. Just to bring it to a close, are there any other points or things that you'd like to raise? I've put my email, you've got it anyway, but it's in the chat. If you want to contact me about anything, please do. We do try and signpost you to where you can get the right information. Please don't ring me up and tell me that you have no insurance for your business, because that does cause me a bit of panic, and at my age I can't cope. We have a full meeting on the 27th about recruitment and retention, and I'm sure that will again impact with staff health, staff well-being, but also with training and funding. So please, folks, let us know. And on that happy note, thank you, and I look forward to seeing you again. Okay, all the best. Bye bye now.
Bye.